doctor ordered a home nebulizer to treat your child's breathing problems. A nebulizer delivers medicine to the lungs as a fine mist. This is also commonly called a breathing treatment. There are a number of medicines that can be delivered with a nebulizer. Most of these medicines treat asthma, bronchiolitis, or cystic fibrosis. The nebulizer works by using a compressor to deliver a stream of gas that goes through the liquid and creates a mist. There are two main parts to a nebulizer system: the compressor, which generates the stream of gas, and the nebulizer kit. Inside the nebulizer kit is the air tubing, the nebulizer cup, a flex tube, a T-piece, and a mouthpiece. And you may also be given a mask. There are many companies that make home nebulizers. Follow the specific instructions included with your nebulizer kit. Always wash your hands before preparing for any treatment. Hand washing is the most effective way to stop the spread of germs. Find a quiet and comfortable area in your home. It's important for your child to take the treatment without any interruptions. Place the compressor on a flat surface near an electrical outlet and plug it in. Open the nebulizer kit and assemble. First, attach the T-piece assembly or mask to the nebulizer cup. We will talk about the difference in just a moment. Take the air tubing out of the package and connect this to the compressor. Now connect the other end of the air tubing to the bottom of the nebulizer. Be careful to plug this into the hole in the bottom of the nebulizer and not onto one of the legs of the nebulizer cup. Remove the T-piece assembly or mask and put the exact amount of medicine that the doctor has prescribed into the nebulizer cup. Replace the T-piece or mask. Turn on the compressor and make sure you can see a mist coming out of the mouthpiece or mask. There are two main ways to take nebulizer treatments. For children 8 years or older, use the mouthpiece for the treatment. Have your child place the mouthpiece between their teeth. Have them close their lips tight around it, making a seal. Have your child take slow breaths through their mouth, not their nose. You should see the mist disappear from the flex tubing when they breathe in. This lets you know they are doing the treatment right. You may have to coach your child when they first are learning how to use the mouthpiece, and be sure to give them lots of praise when they do it right. Mask treatments are used for children less than 8 years old, or when many treatments are given in a row. With the mask treatment, you will not use the T-piece assembly. The mask is placed directly on the medicine cup and then placed over the child's mouth and nose. The mist fills the mask so the child can breathe it in whenever they take a breath. Young children can be afraid of the mask, so you need to show it to them before the treatment. You can pretend it's a pilot's mask, you can use it with a doll, or you can let your child play with it for a while. This is a good way to help them overcome this fear. Try to keep your child calm. Some children may start crying at the beginning of the treatment, usually because they are afraid. However, when they realize it doesn't hurt, most children will usually stop crying. Another but less effective way to give a nebulizer treatment is called the blow-by method. Delivery of medicines using blow-by should only be given for special situations. Your respiratory therapist or doctor will decide if this is a good way. Since the blow-by method is not preferred, we will not demonstrate this method. When you're ready to give the nebulizer treatment, have your child sit upright in a comfortable chair. It is also important to keep the medicine cup upright so that it does not leak. Keeping it upright makes sure that it works efficiently. Coach your child to take slow breaths through their mouth. The treatment will usually last 10 to 15 minutes depending on the amount of medicine in the cup. When it begins to sputter, shake or tap the medicine cup once or twice. This makes sure all the medicine falls to the bottom of the cup. If it continues to sputter, the treatment is done. Turn the nebulizer off and set aside the nebulizer for cleaning. At the end of the treatment, have your child take several deep breaths and try to cough up any loose secretions. After each treatment, you will need to take the nebulizer apart and wash all parts, except for the air tubing. You will wash the parts in warm, soapy water. Rinse with clean water, shake off the excess, and place the parts on a paper towel to air dry. Once it's dry, store in a clean container. Once a week, the nebulizer kit should be sanitized. You can do this by either boiling the parts in water for 5 minutes or putting them through a cycle in your dishwasher. An alternative to these methods is soaking them in freshly made bleach solution. The bleach solution is made from 1 tablespoon of bleach added to 3 cups of water. Soak the parts for 3 minutes, then rinse with clear water. Place the nebulizer parts on a paper towel to air dry and discard the bleach solution. You will not need to wash the air tubing or the compressor. If the compressor does get dirty, you may wipe it with a damp cloth. Remember, there are many different brands of compressors. You will need to follow the manufacturer's instructions for the specific care of your compressor. It is a good idea to keep an extra nebulizer on hand in case there is damage to the one you are using. Frequently check the nebulizer for cracks and medication buildup inside the cup. If the treatment takes longer than usual, check to see if the nebulizer is misting. If it is not, the nebulizer may be clogged or the compressor filter may be dirty. If the treatment is shorter than usual, make sure the medicine is not leaking out of the cup. Either the cup is not screwed on correctly or there is a crack in it. This has been a basic overview of home nebulizer use. If you have questions about how often to give treatments or changes in medication dosages, please contact your child's doctor. If you have questions about the equipment you're using, contact the home equipment company. For replacement supplies such as nebulizer kits, aerosol masks, or compressor filters, check with your insurance company or the home equipment company. Please refer to any handouts you may have received for specific information about home nebulizers.